Morning, everybody. I'm Sherry Sensibri, and I'm the chair of the Speech Language Pathologists and Audiologists Advisory Board. And I'd like to call this meeting to order at 9:03. The first thing we need to do is have a little reminder about turning off your mics if you're not speaking. So if you would mute, just so we don't pick up any background noise, and then remember to unmute when it's your turn to speak. And also remember that we need you to announce your name each time you speak so that that's on the record. Our first order of business, Angelica is going to call the roll to make sure that we do have our quorum.
All right. Emmanuel Bodner. Looks like he's absent. Chevelle Bryant.
Present.
Dr. Tammy Camp.
Present.
Dr. Kristen Culp.
I'm sorry, present.
Christina Kelly is absent today. Kimberly Ringer.
Present.
Elizabeth Sterling.
Present.
And presiding officer Sherry Sensibrian.
Present.
You have a quorum.
Thank you, Angelica.
Same.
We received the minutes of August 20th recently in our board packet, so hopefully you took a minute to review those. At this time, I'd entertain a motion to approve the minutes of our August 20th, 2021 meeting.
So moved.
Kristen, sorry, I can't look around the Zoom screen or the screen fast enough. And who seconds?
Second. Elizabeth Sterling, seconds.
Thank you. Great. All in favor? Angelica actually is going to call the roll so that we will capture that.
Great, thank you. Chevelle Bryant.
Present.
Oh,
aye.
this is in favor or not?
Dr. Tammy Camp.
Approve.
Dr. Kristen Culp. Uh-oh, did we lose her? Okay.
Aye.
Kimberly Ringer.
Approve.
Elizabeth Sterling.
Aye.
And presiding officer Sherry Sensibrian.
Aye.
Motion passed.
Motion carries. The minutes of August 20th are approved. We had no public comments submitted for this meeting, so that item is pretty quick to deal with. So the next thing on the schedule will be our staff reports. And Leonard Rivas is up first with our licensing division.
Good morning, advisory board members. Thank you for being here. My name is Leonard Rivas with the licensing division. You should have a copy of the report in your meeting materials. And we have numbers for FY 2020, FY 2021, and then I will go over the numbers at the end of September for FY 2022. So for speech pathologists, we issued 88 new licenses, 470 renewals, and the total population at the end of September is 16,840. For interns, we issued 80 new licenses, renewed 15, and the current population is 1,055. Speech assistants, 66 new licenses, 119 renewed. The current population is 4,409. Audiologist, 8 new licenses, 49 renewal, and 1,508 is the current population at the end of September. Audiology intern, 2 new licenses, no renewals, and the current population is 52. And I think that's it.
Uh-oh, where am I?
Did we get mixed up, Angelica?
I'm not sure where
There
my
was
staff report
assistant.
is.
Yeah, there's assistance. Is that assistance?
No,
I'll go off my
next page.
I'll go off my paper.
Yeah.
It's okay. So for assistants, we had 1 new license, 2 renewals, and the current population for audiology assistants stands at 34. And that concludes my report, unless you have questions for me. Sherry, you're on mute.
Muted.
That's the hardest part about muting and unmuting, right, is remembering to. So thanks, Leonard, for that report. And Dawn Robinson is up next to give us a report from Customer Service Division.
Good morning. TDLR, good morning, advisory board members and TDLR staff. My name is Dawn Robinson. I'm one of the managers here in customer service. Before you, you see the fiscal year 2020 total for calls and emails. And below, we also have the 2021 calls and email totals. When this report was generated, the 2022, the first two months were not out yet. I can get those to you if you need them as quickly as possible. But the emails were down from 2020 to 2021. They were down from 12,196 to 5,108. And our calls were also down from 2020 to 2021, from 18,000 calls to 17,922. So we've had an actual decrease over the last two fiscal periods in calls and emails thus far. If you have any questions, I'll be glad to assist. Thank you.
Thank you, Dawn. I'm sure you're not missing those few extra calls. Hopefully people have gotten used to things like our telepractice rules and won't need quite as many contacts with customer service to figure out what they're doing. So
yeah, I think so. Thank you.
Great. Thanks for that report. Karen Cox will give the report from the Enforcement Division.
Good morning. I'm Karen Cox. I'm Senior Prosecutor with Enforcement. We have a couple of personnel updates. On September 15th, 2021, Kimberly Ferrero Mitchell was promoted to Management Analyst. She's worked for TDLR for 13 and a half years. Previously was a legal assistant 3 and 2, working with in the small and high profile team. Also on September 15th, Estella Ramos was promoted to Senior Legal Assistant in our intake section. Estella has worked for TDLR for over 6 years, previously serving as an intake administrative assistant and legal assistant too. Case statistics, starting with fiscal year 2022, which this covers just the month of September. Fiscal 2022 started September 1. We opened 8 cases in the speech pathology audiology program, and we closed 8 cases. The average time to close was 240 days. We resolved 37.5% of our cases within 6 months. A quarter of our cases resulted in disciplinary action, and we had 36 cases pending at the end of fiscal year 2021. To analyze those statistics a little further, give you a little more information about the raw stats. 87% of our cases for fiscal 2022 were consumer complaints, and 13% criminal history. Those are licensing complaints where a licensing applicant or renewal applicant has a criminal conviction or criminal penalty on their licensing and in their background, and we review those. The case outcomes for fiscal 2021 are very short. We assessed 2 penalties of $12,000 and we collected that penalty of $12,000. We had no commission or default orders and 2 agreed orders. We informally resolved 6 cases. The alleged violations at opening through September, and this is from the complaint itself. This is with no investigation. This is just what the complaint itself says, and we haven't contacted the respondent. So there were 2 code of ethics complaints and 1 criminal history complaint. In our cases resulting in disciplinary action for fiscal 22, there were 2 cases, and both of them were for billing for services not provided. We have some key statistics now for fiscal 2021 from September 1, 2020 through August 31st, 2021. We opened 59 cases in this program. We closed 74 cases. The average time to close was 214 days. That's 5 days over the entire average for all other programs, which is actually in line with what we should expect. We closed 44.59 cases within % of our cases within 6 months, and 8% of our cases, or 8.1% of our cases, were closed with disciplinary action. brief aside on what disciplinary action is. We close cases in several different ways. We can close it because when the prosecutor receives it, there's no insufficient evidence of a violation or some other resolution, and that gets a closing letter. We can close it with a warning letter, which is an information for the respondent that there was some evidence of a violation, but not enough for us to proceed. What constitutes disciplinary action is a final order, either an agreed order or a default order signed by the executive director, or a final order, which is after notice and hearing and goes to the commission. So Angelica, can you scroll back down a little bit? Because I talked back up to the pie chart.
Oh, you said that.
Thank you. For fiscal 2021, our cases were 88% consumer complaints, 10% criminal history, and 2% departmental complaints. And the results of those cases were there was one commission order. Now, Angelica, if you could scroll up so we can read that a little bit. One commission, other direction.
Okay, that's down. Okay.
Thank you. One commission order, one default order, 4 agreed orders. We assessed $7,125 in penalties, and we collected $5,325 of those assessed penalties. No licenses were revoked or suspended. We had one license revoked for criminal history. The distinction being disciplinary action is a case that we investigate and proceed. Criminal history is based on the DPS report of their criminal background. So no cases went to hearing based on our investigations to revoke a license. One license was revoked for criminal background. There were no cease and desist orders, and we informally resolved 68 cases. And going to our last page for some case updates, description of a couple of our cases that we had. Oh, this is violations at opening for fiscal year 2021. 29% were code of ethics violations, 12% were falsified records. 7 cases were billed for services not provided, 6 for criminal history, and so on down to 1 complaint of violation of a disaster order from the COVID-19. Again, those are violations at opening. The cases resulting in disciplinary action, again, those are final orders, as the case as described. We had 2 cases based on criminal background, 2 cases for failing to maintain records, 1 for failing to comply with an order, and 1 for falsification of records. Case highlights. On September 21, 2021, that's rather hard to say, the executive director signed an agreed order imposing a penalty of $10,500 on the respondent for 7 instances of billing for services which the respondent did not provide. The penalty has been paid in full. On August 12, 2021, the executive director signed an agreed order imposing a penalty of $1,500 on respondent Leslie Smith for falsification of records. That penalty has also been paid in full. Finally, on September 9th, 2021, the executive director signed an agreed order imposing a penalty of $1,500 on respondent Catherine Ann Schrader for 1 instance for billing for services which the respondent did not, in fact, provide. And again, that penalty has also been paid in full. That concludes our data. Are there any questions I can answer?
Seeing no questions, thank you, Karen, for that report. It's always interesting to see what people are doing that might come to your attention.
Thank you very much.
Next up, the Education and Examination Division, represented by John Schildwachter.
Good morning, everybody. My name is John Schildwachter, and I represent the Education Examination Division. As you can see before you today are the statistics for the jurisprudence examinations, but that's kind of a hard word to say. I should have practiced that a little bit more. You see the stats for all the way back to FY 2020. As you can see, the brand new stats for FY 22 are right at 122 between audiologists and pathologists. If we could scroll down a little bit more. And then we have our totals there for, you can see also totals for FY 2020. We'd also like to point out that we have begun the transition to a brand new web form. If you're familiar with the customer services portal for contacting them, it's very similar to that. It should be allow us to be much more effective and much more timely in our responses to questions that are emailed to us. And I'm here to answer any questions you may have.
John, would this is Kristen Culp. Would this be an email useful for checking that all records have gone in for licensure, or is that mostly directed at jurisprudence or any other testing?
These would be for any kind of questions you may have, for really for anything that we can help you with from within our division.
Any other questions for John? Regulatory Program Management Division, our report will come from Katie Bryce this morning. Morning, Katie.
Good morning. Thank you. I'm trying to start my video and there it is. It looks like it's going through. Okay. We have been working on bill implementation teams to implement statutory changes from the 87th regular legislative session. If I didn't say it, I'm Katie Bryce with Regulatory Program Management. Sorry. I am leading the team to implement Senate Bill 40 and House Bill 4. Senate Bill 40 allows the Commission to adopt rules, including telehealth rules and rules for remote supervision. House Bill 4 allows HHSC to adopt rules allowing for reimbursement of some audio-only services, including speech-language pathology services. We'll be monitoring HHSC rules to see if they adopt any rules for audio-only services, but at this point, there's no action needed for us to implement House Bill 4. We have assisted Office of General Counsel reviewing and drafting responses to public comments received on the current proposed rules. And we've also been working with our Versa developers. Versa is the licensing software system we use currently to determine the ability to submit license notifications upon approval of licenses and changes in supervision. We have gotten approval to start doing the license notifications, and so hopefully those will be going out. So when an applicant submits their application, you know, it can take a few weeks or a few days to get their license approved, and then a few more days before they actually get the license certificate in the mail. And so this will notify them immediately once the license has been approved. So they'll know while they're waiting for it to come in the mail. If we go down just a little bit. So on Thursday, we sent out a notice regarding the U.S. Food and Drug Administration proposed rules establishing over-the-counter hearing aids and the updated draft guidance, regulatory requirements for hearing aid devices and personal sound amplification devices. We sent an email out to our subscribers, and we also posted information about this on our webpage. As most of you all know, in August of 2017, the U.S. Congress passed the FDA Reauthorization Act of 2017, which in part defined over-the-counter hearing aid and required the FDA to establish a category of over-the-counter hearing aids. So this happened, you know, back in 2017. We've been waiting for a while for these rules to come out, and on our webpage we have links to the proposed rules and also information on where you can go to submit electronic comments. And I had a booth at the Texas Academy of Audiology conference in Houston last weekend, which was a great conference and really nice also to see our licensees there. Do I have any questions? Okay, thank you.
Great. No questions for Katie. Thanks, Katie. Katie's always super responsive to things that come up. I feel like there are always new things that happen people have questions about, and Katie's our go-to to deal with all of that. So thank you. From the executive office, David Gonzalez.
Good morning, Presiding Officer San Cibrian, Advisory board members, it's only been a couple months since we've seen you, but we're glad to see you. I'm David Gonzalez. I'm the Deputy Executive Director of Licensing Services. I oversee customer service, licensing, and education examination divisions. Our report will be brief because we don't have too much to update since our past 2 months. I assure you, you've heard from the reports given by our staff. We are working hard to implement all the requirements of the past legislative session. The most significant for us is probably from the larger programs. The BARCOS program is requiring a merger of the barbering and cosmetology professions into one license. So that's taking up quite a bit of our time. And our sunset bill requirements, which again, I provided y'all last meeting, we got extended for another 12 years, which is a big deal for us, a big cheer that we're going to be around for another 12 years. But we also have about 12 years worth of work to catch up on to get all these things done. So definitely staff is doing the labor, the participation. Again, every division, all hands on deck, trying to get this work done. That's really all I have to update y'all on. There's stats as well that I think we announced last time. Miss Angelica, if you could please bring those up. I think we've got 2 months worth of stats to update you on. So over the past 6 months, from April to October, the Speech Language Pathologists and Audiologists website had 20,781 views. 59% of those visitors accessed the site from a desktop computer and 39% from a smartphone. The top reasons for visiting the site: applying for a behavior analyst license. I think we're looking at the wrong ones. It says speech language pathologist on the top, but it says behavior analyst license. I don't know if we have a correction for this or not, Miss Angelica.
Let me get with Josh real quick, see if I can't get those and we can come back
That's
to it.
fine, and we can actually report those numbers to you later. Let's go ahead and proceed with the meeting and on with the agenda, and we'll update you on those numbers. They are important to us because that is our interface with our public, and that's how we figure out if our website's working. But Angelica, yeah, if you could find out those numbers, we'll report them later. And Miss Mary, did I forget anything? I know I appreciate you being here from Louisiana.
I am here, and that's it. This is a great meeting, y'all.
Everything's moving smoothly, so
Yes.
thank you, David, for your report, and we'll check back with you in a little while. So the next thing on the agenda is going to be it's Wendy Pillow's turn to walk us through, as usual, some of the rule changes to be considered.
Great. Good morning. Wendy Pello, Senior Assistant General Counsel. This is Agenda Item F, and these are the comprehensive telehealth proposed rules that include proposed amendments to existing rules, a new rule, proposed repeal of existing rules. All the affected rules are listed in your agenda on that agenda item. Just as a reminder, these are the rules we talked about at your last meeting on August 20th. And again, we spent time during the last meeting walking through the detailed rules. Won't do that again unless you have questions or any issues that come up. But just as a reminder, these proposed rules made like 4 categories of changes. They were implementing the telehealth emergency rules that were adopted, implementing those emergency rules on a permanent basis. They're implementing Senate Bill 40 from the 87th legislature. Again, that was the telehealth bill for TDLR's health-related programs. They are including changes as a result of the 4-year rule review related to telehealth and remote supervision, also known as telesupervision now in the proposed rules. And then just did a reorganization of the current provisions and eliminated duplicative provisions. So those are kind of the 4 categories of changes that are in those rules. Again, we met on August 20th to walk through these rules. The advisory board made a few changes to the rules at that time. Subsequent to the advisory board meeting, but prior to publication, we made a few cleanup changes. And then we also, there were some changes that were suggested during the meeting regarding audiology assistants and the fitting and dispensing of hearing instruments. We removed and didn't include those recommendations in this proposal because we were looking at those proposed revisions and they would conflict with the statute existing rules. So we pulled those out. And those were explained in the preamble, the proposed rules, where those slight changes were. And that's only related to the audiology assistants. We published the proposed rules in the Texas Register on September 10th for a 30-day public comment period that closed October 11th. And the department received 3 public comments on the proposed rules. 2 comments were in support of the rules. 1 comment was suggesting a change. You have the comments and the proposed rules in your packet of materials. So I'll highlight those quickly, but just so you know, the department's not recommending or making any changes to the proposed rules based on those comments, but we did want to give the advisory board an opportunity to discuss or have any comments or feedback on those public comments. The first comment was the comment related to the proposed change. They were recommending they were making a comment on section 111.51, which is the assistant speech language pathology license, and it's the supervision requirements. The commenter was stating that in light of COVID-19, the initial contacts have been increasingly difficult to allow for timely initiation of care. And the commenter was suggesting having the SLP supervisor to either conduct a chart review or have an initial contact with the client to determine whether the assistant had the skill set to provide services to the client. The commenter was stating that all the assistants in Texas have at least a bachelor's degree and have received training. The department's response on this was we weren't agreeing to make this suggested change in this proposed rulemaking. What they're requesting to amend is subsection F under 111.51, which requires the supervising speech language pathologist to have the initial contact with the client, and that's in their caseload, and then before allowing that assistant to provide services. And what it's appearing that the commenter is wanting to do is to expand that provision to allow the supervisor to either conduct a chart review or initial contact with the client to determine whether the assistant's competent to provide services. 111.51, that section had proposed changes, but it was only proposed changes in subsection E and G, not the initial contact requirements under F. And in fact, a similar provision was put in later in the telehealth rules about client contacts and communication in the telehealth. And that section is under 111, under 212 F1. And this was the provision that was the initial contact between the provider and client, maybe at the same physical location or through telehealth as determined appropriate by the provider. And then for a provider who is a speech language pathology assistant, the initial contact with the client must be made by the assistant supervisor. So we had carried over that same existing provision that's in 111.51F over into the telehealth. So in our opinion, the suggested comment from the commenter is kind of beyond the scope of what we were proposing to change and would be a substantive change to both the existing and the proposed rules. So if this is an issue that the advisory board would want to study and review, we would do that in a future proposed rulemaking. If you want to have a work group to study the issue, not the comment will address in this proposed rulemaking. But if this is an issue that the advisory board would want to study, we could do it in a future rulemaking, but we weren't going to make any changes at this time. I didn't know if anybody of the advisory board had any comments or questions or thoughts on. Yes.
This is Elizabeth Sterling. I'm just trying to clarify for myself. Are we talking about whether a chart review would be required by the supervisor before that during that initial contact, or I'm trying to understand what it is that we would be discussing in that meeting that.
Right. It's what the commenter was suggesting and what our understanding of what the comment was they were doing, instead of having the requirement that the supervisor has to have an initial contact with the client before and to determine whether the assistant could provide services, this would allow the supervisor to either do the initial contact with the client or do a chart review. That's our understanding of what the comment is. So that's what we didn't know, if that was an issue, whether to expand that and not have that initial contact with the client by the supervisor, if that's something that the advisory would want to explore. But again, we would recommend something like that would need to be in a future rulemaking, because that would be a change to not only the proposed rules, but the existing rules, because that wasn't something that was part of the proposed changes.
Okay, thank you for that clarification.
This is Sherry Sensibrian. I think that's still a consideration. Part of consumer protection is to be sure that before you assign an assistant, to work with a particular individual, that you're confident that the assistant has the skills based on the needs. And I do chart reviews daily, and I can tell you there are lots of things not in the chart. Meeting the individual is important, and we've never defined the initial contact as, you know, a full hour diagnostic evaluation or anything like that. It's just an initial contact. So personally, I feel like it's a consumer protection issue that you know the patient before that you assign them to an assistant. And in a very brief initial contact, I don't think that's too burdensome to expect.
Well, and speaking, this is Tammy Camp, and speaking from someone who refers patients for this, I would like to know that it's more than just a chart review that has determined who is going to provide that therapy. So I would agree wholeheartedly.
Great. Thank you all for your feedback. Appreciate that. It's helpful. Yeah, so we weren't recommending any changes, and it doesn't sound like the advice board is in agreement or wanting necessarily to have that referred out. The second comment was from an individual. They were in support of the proposed rule that would allow interns and assistants to provide telehealth and would remove the cap on terms of the limits on how much supervision could be performed by telehealth, now known as telesupervision in the proposed rules. They had offered a comment that it didn't seem like there's an increase in complaints over the last 18 months, which would have been when the telehealth waivers and the emergency rules have been in effect. And then they just expressed appreciation for keeping the rules up to date. And the department appreciates the comment, but we didn't propose any changes based on that comment. Any questions, comments, thoughts on that? Okay, and then the third comment I received was from the Texas Speech Language Hearing Association, and they submitted a comment in support of the proposed rules under Chapter 111, subchapters A, E, F, J, and B. And then the association supported all the proposed rule changes, and it stated that it will allow for increased access to services, increased coverage of rural areas, and increased flexibility in providing services safely during the pandemic. And again, we appreciate the comment and didn't make any changes. So I open that up for any comments or questions or discussions by the advisory board on the proposed rules or the public comments. Then we would just be, the department would be seeking a recommendation from the advisory board, and the recommendation be that the commission adopt the proposed rules as published in the Texas Register.
I move that the commission accept the proposed rules as published in the Texas Register.
So this is Sherry Sensei-Marian. Dr. Camp is proposing that we recommend that these rules be accepted by the commission. And do I have a second?
Elizabeth Sterling seconds.
Sir Sterling as a second. Thank you. Angelica, would you poll everyone for their response?
Yes, ma'am. Chevelle Bryant,
Oops, I think you
you're
might.
muted. Chevelle Bryant?
Can you hear me?
Yes, now I can. Dr. Tammy Camp?
Approve.
Dr. Kristen Culp?
Approve.
Kim Ringer? Back to Ms. Ringer. Elizabeth Sterling?
Approved.
Kimberly Ringer? Presiding Officer Sherry Sensei-Marian?
Approved.
Thank you all.
Your motion passes.
Thank you. Great.
Thank you. And these will be going to a future commission put on a future meeting for their agenda for their consideration. Thank you all.
Okay. Nothing else from you, Wendy?
Not on this item. Thank you.
Okay, great. So Sherry Sensei-Marian here. There was a licensing work group that met about a year ago or a little over a year ago to consider a change to the rules based on a conversation that was had in one of our last face-to-face meetings pre-COVID, I think. And I think it must have been Mr. Bodner who brought up the issue of proof of licensure and how people know if you are licensed or not. And so our work group met to discuss the issue that while the rules actually said that you have to display the license certificate in your primary office or place of employment, that many of us actually provide services either out in people's homes, or if you're in a school, you may be in someone's classroom. So the person receiving the services might not ever see your license. And so that led us to the discussion that really the whole point of the display is so that consumers can feel comfortable that they can see that you do hold a license. And so that led to a change that we are recommending for 111.151 about the display of the license. And I don't know, Angelica, if you have that to share. I know I don't think I have it open on my computer.
Give me one moment. Let me grab that screen. Here we go.
Thank you. So those are the issues. And here is our recommendation. I think that's helpful if you can see it in print. So we're not changing anything, items A through D, but we are recommending the addition of item E. If you'll scroll forward to item E. There we go. So this is our recommendation that we add to this rule. Upon request, a licensee shall provide proof of licensure to a client by showing the current license certificate, the current license identification card, the little plastic card we received, or the current results of a license search on the department's website. So it leaves you lots of options if someone should ask to see your license. You have several ways that you can demonstrate that your license is current. And so that's the recommendation from our work group. And any feedback about that? Questions? No, everybody's good. So Wendy, help me out here. Do we need a motion to accept this recommendation to move forward? Wendy, Katie, somebody?
This is Wendy Pello. You could do a vote on the recommendation. Again, these are not proposed rules now. This would be a recommendation that, you know, in a future ruling, this the licensing work group's recommendation on these proposed changes could be incorporated into a future rulemaking.
Okay, well, I think that'd be great to get a sense of the board if you would support this recommendation to go to the next time that we do rulemaking. So Angelica, could you check with everybody?
Sure. Chevelle Bryant,
Yes, I support it.
Dr. Tammy Camp,
Agree.
Dr. Kristen Culp.
Agreed.
I think we lost Kim Ringer. So Elizabeth Sterling
Agree.
and Presiding Officer Sherry Cyprian.
Agree.
Like everyone approves.
Great. So we will recommend that this goes forward for the next time that we do rulemaking. Right.
Thank you.
Thank you. We are now moving on to item H on your agenda, discussion and possible action to assign topics for consideration for work groups. So the standard of care work group, there's an issue that we may want to refer to them about screenings. So Wendy, would you tell us a little bit more about that?
Actually, I'm going to refer this to Katie Bryce.
Oh, great. Katie, thanks.
Sorry. Thank you.
Thank you. I'm Katie Bryce with Regulatory Program Management. I've received a few questions recently about cognitive or cognition screenings, and the statute, specifically 401.403, practiced by audiologists, says an audiologist may perform basic speech and language screening tests and procedures consistent with the audiologist training. There's also language in our rules about screenings which may be performed. And so we just thought it would be helpful to send this to the standard of care work group so that they can determine if we need to have some proposed rules that might include cognition or cognitive screenings or other screenings, just to give some clarification on scope of practice.
This is Sherry Cyprian. So Katie, do we have the leeway within the act to expand what the act says? It doesn't refer to anything except speech and language screenings, right?
Right,
by
but,
rule, can you expand that?
well, one of the things I noticed when I did some research on this is that many of these cognition screenings include a language component to them. So in that sense, it does fall under the current, allowable practice in the occupations code of a language or speech screening. And so since it's not just very clear in the rules, we would like to just have some more language if that's what the work group and the advisory board determine
Okay,
that they
so
want to do.
it would just maybe clarify what's in the
Yes.
act. That was written a long time ago, and so this may not have been so much something to think about back then. So, okay, thank you.
Right. This is Wendy Pello, if I may just add. I think that'll be part of the, you asked a great question in terms, I think that's part of the study of sending to the work group of what does the statute say where, because we can't expand the scope of practice through rules, but if there's places where it can clarify if it's the statute has broad language or general language to make sure we can clarify that.
Okay, great.
Thanks, Wendy.
Susan Sibrain here. As I remember, we did set up the work groups again for this year, so I'm sure Angelica has a record of that, and we can refer this to the standard of care work group and work with staff to get a meeting to start working on this.
Yes, ma'am.
Okay, great. And item I is recommendations for agenda items for our next board meeting. Are there some issues
Real
out
quick-
there? Katie
Real
usually
quick,
knows
Ms.
what.
Cherry, we have the updated statistics for you that David's going to go over. So I'm going to share my screen real quick.
Okay, great.
We'll go those real quick and then we'll move on to the next one. There you go.
Speech language pathologist and audiologist for the past 6 months. This is David Gonzalez, Deputy Executive Director. From May through October, we had 215,457 views on that webpage. 69% accessed the site from desktop computer and 30% did so from a smartphone. The top reasons for visiting our site is forms, applying for a new assistant license, renewing a speech language pathology or audiology license, supervision of interns and assistants, and applying for a new intern license. Thank you very much, Presiding Officer Sensibrian and Angelica, for getting us those updated numbers.
And thank you, David, for that report. It's great to see that the website gets used a lot. So shows you how important it is. People go there. That's great. Okay, so back to item I, which would be recommendations for the content for our next board meeting. Katie, you usually know what the burning issues are. Is there something that you've noticed or something any board members have?
This is Katie Bryce. The thing that I wanted to have referred was under agenda item H, and if anything else comes up, I will certainly let the advisory board know. I don't have anything else right at this moment.
Okay. Any other topics from staff? I know we'd have the usual staff reports, but anything else that we need to make sure gets added to the agenda?
This is Wendy Pello. I think if we don't have any immediate rules, this was kind of the telehealth rules you did today was kind of the last set rules we have. We've, at your last meeting, you have a bunch of work groups that'll be able to meet and kind of discuss the rule review, public comments and staff comments. So once the work groups have a chance to meet and discuss, there'll probably be some worker reports coming back. We'll give them a chance to meet, but we don't have any pressing rules at the moment.
Great. Thank you for that, Wendy. The next item is discussion of our next meeting, but given that we don't have any pressing rules changes and we need time for the work groups to meet, I think it's a little premature to try to actually set the date. It has worked beautifully for Angelica to poll everybody, and she somehow manages to make everybody's schedules mesh and figure out a time that will generally work. So when we see that it's time to have another meeting, I would just count on Angelica to be able to do that. Get in touch with us. So any other last minute things that we've neglected, something that we need to take care of? If not, then I am going to adjourn this meeting and thank all of you for your time this morning. It was good to see everybody, and we are adjourning at 9:48. Thanks, everyone.
Everybody.